In the next 3 days, we will have plenty of discussions around the topics of health, youth, well-being from various perspectives, as we just saw. And we will have interesting keynotes, experts joining us. And of course, you yourself are experts. So we also want to give you a lot of networking opportunities to meet and interact and discuss how we can enable young people coming out of the pandemic. To make sure that all of us will have some 3 good days together, you should have received a participant's guide. And if you haven't, then please, after the plenary, go outside and register just to make sure that you will find your way around the event. I want to highlight 2 specific safeguarding aspects once more. We have 2 safety officers here that will be in charge at all times to support you and guide you. And you can recognize them by the wrists they wear. And I think there we have one, so maybe turn around and there you see one of the safety officers who will be roaming. And there's the second one on the left side, and she will be at the registration desk. So you can identify them by their colorful scarves as well. And if you feel like you need any support, or maybe also the code of conduct is being violated, which you can find in the participants guide, then please make sure to reach out and to let us help you navigate through the event, because we want you to be comfortable and to make the most out of the experience. We also provided for this sake a quiet space, which is on the 2nd floor, close to the restaurant on the terrace. And that's the place where you can maybe also socially recharge, but also in case you need some decreased sensory stimulation, then that's the place you can go to feel comfortable. So again, we want you to get productive, to have a fun experience, an interesting experience. So the organizers have been working very, very hard to enable you to really shape this event. So again, reach out to them if you need help, and maybe we can also give them a round of applause for all the work they've put in. But now let's look at what awaits you at this forum. And for that, I will invite somebody that I would say knows very well what is going to happen in the next 3 days, and also what should happen with the outcomes of the forum. So I would like to invite Rob Butler, the Executive Director of WHO, the Regional Office for Europe. He will welcome you to the forum and also introduce us to the ideas behind the forum. So please, Rob, join us as one of the hosts of this event. Perfect. And maybe you can tell us, what was your initial idea when you shaped and developed this Youth for Health Forum? And also, what do you expect from coming out of the forum? I'm really curious to hear that.
Okay,
the stage is yours.
Thanks very much, Clara. So your first speaker is not a member of the youth community, as you can see, but I'm very, very happy to be here. I've been so excited about this event, smiling for the last fortnight, just in anticipation, because it's been a long time coming. This is the first, of course, our inaugural Youth for Health Forum event. It's going to be the first of many, many to come, I hope, in the years ahead. And again, a warm welcome to you all to this terrific Tirana and Albania, and of course, Tirana is the youth capital of Europe this year. I'm very grateful to our hosts, who I'll say a few words to shortly. It's long overdue. This is really a step towards overcoming maybe and addressing some of the unfulfilled commitments that you've heard from the health community in the past. For us to take a step further towards engagement, to listening and hearing, more importantly, what you have to say and how this can be translated into real, meaningful action. And that's really what this week is about, is kickstarting, reinvigorating this relationship between us as the public health community and you as the youth forum, and you as the youth representatives and this forum at large. Now, Clara, I knew you were going to ask me this question. So I was fortunate enough to be able to prepare something in advance in terms of a video where I actually went to the youth community, or where we asked particularly our friends Alexander, Laura and Vedran to say a few words about what this forum meant to them and what their expectations were. So if we could kindly play that video, I'll say a few words afterwards. Thank you.
Youth-led initiatives have shown amazing outcomes and innovative thinking, with young people getting more and more involved and growing more vocal in recent years. As youth, we have showcased our readiness to be involved in topics concerning the global future, whether it be regarding climate change, mental health, or other current issues such as the pandemic. As youth, we are ready to shape our collective future.
Last year, 3 days prior to the 71st WHO Regional Committee meeting, 3 youth organizations from Europe, IFMSA, EMSA and IPSF, organized a youth site event with a goal to engage in the collaboration with the WHO Europe. The result was creating a roadmap for youth that were recommendations to the WHO Europe Regional Director on how to engage more with youth in the region.
Roadmap for engagement with younger people in WHO European region and report on Pan-European Commission on Health and Sustainable Development. Final report were outcome documents produced by young people and young professionals last September, accompanied with statement delivered during the RC71.
As a result, we also have today the Y4H event that was organized with these 3 organizations and the community of many more youth organizations for Europe.
The involvement of people with various viewpoints, experiences and opinions has been proven to add to and enrich discussions, leading to overall more well-rounded decisions made. The engagement of our expertise, viewpoints and resources as young people has the potential to lead to marvelous results, shaping a future we all envision. But we need to be given the non-tokenistic opportunity for meaningful involvement. And while we are on a good path, a lot of efforts still have to be made for this to become a reality.
Yeah, thanks to all 3 of them for those interventions. I wanted to also mention, 1 in 3 people in this region is under the age of 30. That's 330 million change makers, 330 million decision makers of tomorrow. But I'm always alarmed when I attend these events that we talk about these decision makers of tomorrow, because it suggests that tomorrow will make the change. Tomorrow is too late. We want to engage you today, and we want to hear your voices today. So it really concerns me that we're still using this terminology. We want to somehow introduce new mechanisms and new processes that will help you engage with us, public health, the public health community, of which, of course, you're a part, but also to capture some of the issues that specifically, acutely affect you, the youth, and this constituency particularly. And here this week we'll be discussing some of these: the mental health, the physical health impacts of the pandemic, the socio-economic impact of not just the pandemic and COVID-19, but a war in our region currently raging. Also to talk to the climate crisis and to sexual and reproductive health issues, which I know are at the forefront of many of your minds, and many of you work in or around in this room. So Clara, I feel that this youth forum really provides us with an opportunity to catalyze change, not change that happens necessarily over the next 3 days, but change that will happen hopefully when we all leave this room at the end of this week. And hopefully we'll have forged new relationships. We'll be clearer on how we engage you, particularly WHO, and we'll have an opportunity later this week, along with UNFPA, to hear from you as to what you expect to change from the UN agencies, what you expect to change from WHO, and how we can engage you better in the future. My regional director, Dr. Hans Kluge, will be here and will say a few words this afternoon. So you'll also hear from him some very concrete commitments from WHO as to how we intend to change the way in which we do business. And not least, of course, the statement that is presented outside and available for you to see outside these rooms, where we hope that we will collectively forge an agreement and some consensus around, so that when we leave the room, we know what we are committing to in the years ahead. And then we look forward to October next year, when we will truly launch this forum at the highest governing body level, the Regional Committee in Astana in October, with our 53 ministers of health at the table and you at the table as a constituency that is well represented and hopefully able to very well articulate what your needs and wishes and expectations are. So my sincere thanks, of course, Madam Deputy Minister, for the Ministry of Health's support. Madam Deputy Mayor, thank you very much for attending and also for your support and organisation of this event. I'd like to thank UNFPA. I'd like to thank all of the UN agencies that have stood next to us. Of course, also to the municipality, but also alongside the municipality, of course, the Ministry of State for Youth and Children and Adolescents, who are very much part of the organising committee as well. So with this, I will thank you all, last but not least, for your attendance, for your participation, for responding to this call that we have made to engage you in better, more fruitful and more productive ways. And I will invite next our sister agency, UNFPA, and I'm looking for Marta. There you are, Marta. Marta Diavolova. Marta Diavolova, the Regional Advisor for Partnerships. Marta, the floor is yours.
Thank you. Thank you, Rob. I didn't get questions, so I have a privilege to follow my speech. Yes. Actually, young people, excellencies, official guests, colleagues, partners. It's wonderful to be in Tirana. I was here maybe 10 years ago, and it was so inspiring to come back and witness the change and aspirations this city has. On behalf of UNFPA, United Nations Population Fund, an agency within the UN system, which aims to deliver, among many things, a world where every young person's potential is fulfilled, we are honored to be here and partner with the World Health Organization on this important forum. I would like to start by congratulating the government of Albania and city of Tirana for bringing youth as a priority within their leadership and giving young people from across Europe and Central Asia the opportunity to influence the European health agenda. We would like to express our gratitude to WHO Euro Office for the fruitful collaboration in preparing this forum. By working together, we will reach far. I'm very proud to stand here as evidence of the professional calibre, commitment and creativity of our wonderful UN team and colleagues in Albania. UNFPA team in Tirana, alongside with the other UN colleagues here, are a great example of the way in which global contribution can support to meet local challenges, and it is a privilege to stand here for them. All of this is important, but none of it would be worthwhile without you being here. It is only because you have spared time to come and join today and in the coming days that this forum can succeed. With such a diversity of participation in this room, civil society representatives, young activists, we hope ministers, public health specialists, we have in front of us promise of a great exchange across sectors, settings, and issues. Nothing about us without us was inspiring slogan that brought us all here for us to support. For more than 500 years, this has been the rallying cry of the excluded demands for inclusion. It is as valid as principle as 500 years ago, and it is as valid for young people, and it is valid for those furthest behind. Too often, young people are not part of designing or reforming the healthcare response to their own situation. There are still situations when young people are, especially those with specific needs, are not offered confidential healthcare services according to their own evolving capacities, or are not believed to be in need for certain services. This is especially critical when we talk about sexual and reproductive health and rights. This Youth for Health Forum is very timely. We need a revolution in healthcare to ensure those who are not heard are heard and included. On the last day, there will be a session on making healthcare inclusive, and UNFPA is very proud to work hand in hand with WHO colleagues to ensure young people and those furthest behind are part of the conversation, participate, come with solutions, and are included for the future to shape together. Without all of them, our common dream of achieving sustainable development goals and delivering on the principles of leaving no one behind will remain only a dream. It is UNFPA hope that those of us who have been malformed by years of study, practice, policy making, we humbly step into the background and give center stage to young people and to the people who represent non-mainstream healthcare needs. We, who are now only young in heart, should be listening in a listening mode. Someone has said that great stories happen to those who can tell them. We need young leaders who will tell a story of development with the center of people-centered approach, with rights as the standard and the conclusive erosion of inequalities as the primary purpose. Yesterday, today, and tomorrow, UNFPA is committed to keep our ears, commitment, resources open and facilitate the inclusion of the excluded everywhere. It is just, it is right, it is smart thing to be done. We wish you a great success throughout these days and strong committed to support the outcome of this forum. Thank you very much.
Thanks very much, Marta, and thanks again to UNFPA. Now, when I first visited Tirana with this agenda, with the idea of forging some kind of youth forum here in Tirana, it was quite incredible, the response that we had from the Mayor's office and from the Ministry. It was quite incredible that they were so in tune with what the youth needed, what the youth wanted, and the expectations, not only in Albania, but further afield. So we then went to the next step and asked you what you wanted represented in this program. And as you can see from the program that you each have, it is an action-packed 3 days ahead. We have a phenomenal program ahead of us over the next, 2.5 days. We'll be wrapping up Thursday mid-afternoon with the wrap-up session. But as you can see, it's action-packed. I'm particularly looking forward to us kicking things off. We've got a workshop on mental health next on the agenda, and a panel entitled The House of Cards of Public Health Policy Making, which I find absolutely intriguing. I'm not quite sure what that means, but I'm looking forward to it. 3 packed days, important discussions that you voted on. I think a very exciting start ahead of us, and a formal launching by the Mayor, the Minister, and the Regional Director this afternoon. With that, I'm going to wish you an incredibly productive week ahead. I'm hoping that you all enjoy it enormously, and I hope you get the opportunity to spend time with each other, to learn from each other. And I know from our part, we are in listening mode this week. We're all available. I speak on behalf of myself. We also have Dr. Gundo Weiler, the Director for Country Support, with us over the next 24 hours. I know we're all available to you, and the entire team I'd like to thank. And Clara, I know usually the thanks for our moderator is usually at the end of 3 days, but I'm going to ask for a round of applause for Clara before she continues. Thank you. And I hand the floor back to you, Chair. Thank you.
Thank you, Mr. Butler, and also Mrs. Diavolova for your speeches. And as we heard, Tirana is the European Youth Capital for this year. And of course, we are also still in the European Year of Youth. So I think this is the perfect foundation to have youth discussions around health and well-being. And again, we want to thank you, Deputy Mayor, for hosting us. And I would now like to invite you on stage. Ms. Anula Restrani, you are in charge of international affairs and sustainable development in Tirana, and you also directed the Tirana child-friendly agenda. So you're an expert in the field as well. The floor is yours.
Thank you. Good morning. Isn't it a gorgeous day outside and we're all stuck in here? Actually, one of my suggestions to the organizers was let's just do an outdoor session, which I do believe you guys have still in your agendas through taking tours of the city. So hopefully this is all good and healthy, but what's healthier than experience in the city? And that's what we're trying to do so far here in Tirana, is to build a healthy city. And by healthy city, sometimes we think of something that's abstract. What's a healthy city? A healthy city is full of healthy people, and healthy young people, most of all. And that's mostly about you guys, and how you experience your day-to-day commutes. You are moving from A to B. You're experiencing your schooling or your work or your workplace, and all of this recreational time that you spend. Because what are cities about? They're about sharing. And what do we all share that we have in common? We all want to be healthy, right? Everything else comes afterwards. We have a great expression in Albanian, which is health before all. And every time our parents would say it when we were young, and say, it's fine, you know, we don't have electricity, it's fine, we don't have running water, you know, when we were really little. You guys don't remember that? Those of you who are local. But at the end of the day, you know, you would just go to bed and they would say, as long as we're healthy. And I think that it all starts from there. But the concept of what we mean by health and what we mean by a healthy life and a healthy lifestyle has really evolved very much lately, hasn't it? When we're thinking of health, we're thinking of how we get up in the morning. Are we in a good mood? That's also health. Do we have bike lanes, or are we congested in traffic? That's also health. Do we have green spaces, and do we share our space in a comfortable way with each other? That's also health. Do we use the staircase, or do we get stuck in elevators? That's health. And there's a variety of these issues that are not directly related to, you know, your blood sample or your oxygen level, but they are so much more related to health that's never been before. And I don't think that there's been any time, anywhere, in any part of the world where getting together and what we call in politics multilateralism has ever been more important. So it's not enough to be healthy just in Tirana, or to be healthy in Paris, or to be healthy in Amman. It's important for all of us to be healthy everywhere at the same level. And what affects one affects all. And I think that that has been the message for the European Youth Capital here in Tirana this year. It's not about one individual group of young people. It's not about a certain age bracket. It's not about certain gender bracket. It's not about a certain income level. It's about how we're all into the same boat, and we see that every day. So I just want to leave you guys in with this message here today, and with a little story of a very, very famous doctor who was finally getting a huge recognition for his lifetime achievement. And what they, you know, usually say is like, how did you make it? How did you make it to be the best one? And he said, well, you know, experience. And they're okay, but then how did you get all this experience? Well, I got it by really being good at things. But how did you get to be so good at things? Well, I made a lot of mistakes. And if there's an age and time to make mistakes, is when you guys are at. And when this is all about testing things and making mistakes, but as long as we do something that resonates with what we're looking for, I think that that all brings us on the same page. Us, we are not allowed to make mistakes. We are only here to serve you. You are allowed to test everything that gets into your mind and really suggest that. So please do not spare your ideas, do not spare your energy. We're here to get all that together. Welcome to Tirana and enjoy the city. Thank you, guys.
Thank you very much, Ms. Ristrani, for welcoming us to Tirana and speaking about health and also, keeping your body fit, especially while we are being stuck inside with the beautiful weather. We also want to invite you to explore the capital of Tirana. There will be some city tours around, so maybe that's a good opportunity to balance for all the seating and mental work which we are about to do. Next up, I would like to invite the Deputy Minister of Health of the Republic of Albania, Ms. Denada Zeferi, to welcome us as well. Thank you.
Good morning to all of you and dear Mr. Butler, participants, mayors, colleagues, youth, and health experts. Welcome to all of you in our sunshine and beautiful Albania. Tirana is a youth capital now, so as you heard, we are all happy to welcome you in this forum and this event in this 2022 year of capital of Albania and of course of youth people. We today have a youth forum with all of its main concepts and aspects on youth health and well-being. But first of all, allow me to thank you all that you are here in Albania, but first of all the team of World Health Organization, UNFPA, and of course our teams of our two ministries, Ministry of Health and Social Protection, the team of Ministry of Children and Young People, and also the municipality of Tirana. On behalf of Ministry of Health and Social Protection, I would like to thank you, all the national experts, all the international experts and health experts that are here and will be in all of the 3 days that will be along of this youth forum. Young people during all the period of pandemic and also of COVID-19 were especially be in vulnerable situations due to their stage of life and disruption to social, educational, emotional, economic, employment, and individual freedoms associated with this time. Youth people have experienced negative impacts on their physical and mental health and have been impacted on by post-COVID-19 and also such as long COVID-19. Additionally, the vaccine uptake among young people remain relatively low in lower middle and upper middle income countries, including Balkans region and beyond. It is today's young people who will face the long-term economic and social consequences of the pandemic. Therefore, it is crucial that they are listened to and included in efforts to protect communities. All young people have already shown great resilience, resourcefulness, and the ability to drive change. All over the world, there have been great examples of youth-led responses to the COVID-19 pandemic, climate change, and other threats. As the leaders of tomorrow, young people should have equal opportunities to actively participate and lead in the recovery efforts from the pandemic, in preparing for future pandemics and crises, and in building a sustainable future for all. Albanian government and Ministry of Health and Social Protection has shown a great response to the COVID-19 pandemic, which was in line with the European response. As a special initiative of World Health Organization Regional for Europe, the Ministry of Health has focused activities and energies to increase the youth and social engagement and to actively working with young groups and other social groups interested for meaningful engagement to amp their voice and perspectives in all areas of work that support the implementation of our COVID-19 agenda and universal health coverage in general, and to ensure that no one is left behind. But why this forum? and the purpose of this forum, of this regional event, and the reason why we are in Tirana, thanks to World Health Organization, to UNFPA, and to all the people that are engaged in this youth forum. The first main is to bring together young people, as well as public health experts and other partners from across the world and from the region, and to share our experiences, to engage in dialogue on the consequences of the COVID-19 pandemic, and to discuss other current health and well-being issues that impact on and are important to young people, to bring together initiatives across the European region and cities' experiences, but not only, to bring health projects implemented so far on and under the process of implementation, which engaged youth initiatives and plans. We do believe that the well-being of youth today is the health of tomorrow. A range of health and well-being topics are included in the forum, and as Rob mentioned, we are just have the information in these 3 days of the forum about mental health, sexual and reproductive health and rights, digital health, disability, climate change and health, inclusive approaches to healthcare, and also non-communicable disease risk factors. Youth health forum like this one could inspire the changes that are needed for the implementation of the joint initiatives and projects, including, of course, all the ministries in the region and also all the organizations on health and youth involvement, to become a truly inclusive and forward-looking organizations, and European countries' collaboration increased, providing that truly leaves no one behind, including youth firstly. We thank you for all of your consideration and look forward to have through our collaboration also and fruitful discussion along the event course. Thank you very much.
Thank you once more to all our speakers for welcoming us and for having a first setting of the scenes for this forum. Now I would say I'm going to transition to this comfortable looking seat, because we are getting ready for some discussions. And for that we have invited a few experts and young people, which I will invite with us on stage in a minute. But first of all, let me introduce you to the topic of the panel, and then we will have some youth voices. Take a moment to think back, maybe 2 years ago when the pandemic hit and the first 6 months of you experiencing the pandemic. Did you have at any point a moment where you felt overwhelmed with the situation, where you struggled with your mental health, where you maybe lacked support, especially as a young person? To be honest, I certainly did, and I'm a very privileged person who actually has very good life circumstances, and that was the first time for me really struggling with being faced with such a situation. And I would say I hope, or probably I'm not the only one, because that's something we need to discuss right now. Particularly during the pandemic in the European context, we saw that young people were not giving enough of a priority at times. We also saw that young people took the lead, and they kind of started to help themselves to establish youth-led projects, to take initiative, to support their peers, and I respect that very much. And also we saw them taking initiative of highlighting support which is needed now. And we saw policymakers taking a lead now, starting to prioritize youth, as we said, with the European Year of Youth, but more needs to be done. And to talk about these issues, I would now like to have a video played with young people speaking about their experience during the pandemic.
Az én életemet nagyon befolyásolta a Covid, mivel hogy elszakítottak a nagyszüleimtől, nem tudtam velük találkozni az alatt az időszak alatt, illetve a baráti kapcsolataimat, azokat nagyon szűrte, mert nagyon sok barátomat sikerült elvesztenem ez alatt az időszak alatt, illetve sok olyan családtagomat is elvesztettem, akik a Covid-ba belehaltak.
It was really important and helpful for me to connect with my family and friends and have daily conversations with them to focus on different aspects of our lives other than the pandemic.
Ki hogy kezelte, én úgy gondolom, hogy ez mindenkinek a személyes ügye volt, hogy továbbra is tanuljon úgy megfelelő módon, ahogy eddig, és menedzselni tudja az életét.
Fontos még ez is, hogy a lelki dolgokra is ugyanúgy odafigyeljenek az orvosok, mint a testiekre, hiszen rengeteg testi betegség tudható be annak, hogy lelki okai vannak. A Covid alatt nekem nagyon nehéz volt, mind lelkileg, mind testileg, mert bennem is megvolt a félelem úgy, hogy nagyon sok ismerősömben és családtagomban is, hogy mi van, ha nem csak velem lesz valami gond, hanem esetleg szerettemben is. Nekem nagyon sokat segített az, amikor a saját országunkban is elkezdték lazábbra venni a láncokat, és tudtunk már többet kommunikálni, az online dolgok is nagyon sokat tudtak segíteni nekem, hogy tudjam tartani barátokkal a kapcsolatot, és hogy tényleg, amikor már mertünk erről nyíltan beszélni, hogy ez minket aggaszt, és nekünk ez egy nagyon rossz dolog volt, azért mi lelkünkről is levette egy picit a súlyt.
Again, remember, as we probably know, sometimes policymakers seem not to know, but youth are not a homogeneous group. We have experienced quite diverse life realities during the pandemic, and I hope that a few of these perspectives will be represented on the panel, which we have in a few minutes, but also, of course, you as youth advocates, you know best the communities, the people, the diverse realities of young people you've met, and we hope also that you will bring in these experiences into the discussions, into the forum. With this having said, I would now like to invite our speakers to stage. And first we have Daniel Dirul as Regional Director for Europe at the International Federation of Medical Students Association, very long name, IFMSA. Please join us. We also have Aisha Morgan representing the Africa Advocacy Foundation, which I'm very happy to have you with us on stage as well. Next up, we have Link Rees-Lynch from AKT, the UK. Please also come to us on stage. And last but certainly not least, we also have Amanda Sherwise, consultant with the WHO European Office for Investment for Health and Development. It's good to have you here as youth experts and youth representatives. We will now discuss the topic of youth health issues through the pandemic, and especially focusing also on your experiences in your project work and how you connect them to the topics of the forum. So let me start with you, Daniel. You're a 25-year-old doctor from the Republic of Moldova, and that means during the pandemic you had two different perspectives on the situation. One being a youth health professional, but on the other hand, of course, also being a young person affected by the pandemic. So let me ask you, how did you experience the pandemic from your professional role as health worker? And you have to, turn on the mics, and also please don't forget to turn them off once you're done.
Okay, thank you so much. So I would just like to mention that back in 2020, when the pandemic hit, I used to be still in my medical university. At the same time, I was part of the international team in IFMSA, but also as part of my university program, I used to work as a medical assistant at the Emergency Institute of Medicine in Moldova. And I just wanted to say that I was kind of there in the front line as our department was a COVID-19 department as well. I honestly want to say that it was hard at some point to deal with patients with the amount of work, but also it has affected the medical education that I was part of, since we were not ready to transit to an online setting. So yeah, it was quite difficult at some moment.
Thank you for sharing that, and certainly all the people as part of the health system, doctors, nurses, but also all other people being involved, you did an amazing and important job through the pandemic. Now, on the other hand, you are also a regional director of IFMSA, and in that role, you work on youth leadership and youth engagement. So can you tell us on how did your organization maybe guide young people through the pandemic? And maybe you can also touch upon your a personal experience being a young person in the pandemic.
Yeah, sure. So first of all, I would like to also say that fortunately, all the weaknesses that were brought to the surface during this pandemic were transformed to opportunities for so many organizations worldwide to work on future events like these in case they happen. A lot of organizations have started to work on protocols that were eventually going to be used when it comes to an eventual pandemic. Some other organizations that deal with medical education issues are started to work on toolkits in order to approach the online setting, the online to discover it, to implement it, to straighten it. Also, did we, as IFMSA, for example, when the pandemic started, we saw it as a very good field in order to increase our coverage through online events, through online opportunities for our members. But at the same time, during the last August meeting that we had this year, we voted upon a new strategy, especially the European strategy that we are going to implement up until 2025, which means that has a specific point and a pillar that future online events should be tackled and worked upon. These are only some examples, but we are really encouraging more and more perspectives like these throughout our communities in Europe and worldwide.
Thank you very much for that first perspective, Daniel. Moving on to Aisha, you are project lead at the UZIMA project, which is part of the Africa Advocacy Foundation. And in the project, you provide support and resources to young migrant women, I believe between 11 and 25 years, that have experienced gender-based violence. So for instance, domestic or sexual abuse, but also female genitalia mutilation. So these are issues that take place or are very challenging both on mental as well as physical level in terms of support. So what challenges and barriers do young people you're targeting with your projects face in terms of accessing healthcare from your experiences?
I think it's firstly, thank you. It's a very complicated, layered and sensitive subject to approach within the young people that I work with who have gone through these experiences, who have seen things that I personally have not seen. And so in trying to understand what they've gone through, I have to acknowledge that I will never understand what they've gone through. And some of the barriers that we face in trying to provide those resources, in trying to allow them, well, kind of urge them towards accessing healthcare, is this element of like learned behavior. So I think we all know you don't have to touch a stove to know that it's hot, because well, most of us have been burned before. I get burned quite often, actually. So with that being said, for specifically FGM, female genitalia mutilation, when so to get a young woman to even access healthcare in the first place is a challenge in itself. It takes a lot of persuading, it takes a lot of patience, and it takes a lot of courage on their behalf. So once they do get that initial consultation and it doesn't go the way that we'd all planned, there's a learned behavior in place. And the same applies to those who have gone through domestic abuse or sexual violence, and they have just one bad experience with one healthcare worker or one social worker, and it tarnishes the way that they can access healthcare for the rest of their lives. And it kind of creates this communal and collective negative perspective of what these resources are. and it kind of makes them the enemy as opposed to support. And that's not of any fault of anyone's, really, besides the few bad apples. But then it's a significant aspect of their journey, because it makes it hard for somebody with FGM to trust their doctor in the future. And that's really important, because that procedure it affects a woman throughout the entirety of her life. Like, you have frequent kidney infections, you have, especially if you want kids and you try to have kids, it's difficult, and then to maintain the pregnancy is also difficult. And so if you do not trust your doctor because of this one bad experience, it's just not good for you or the people trying to help you.
And connecting to that, especially now looking at the pandemic and how difficult the situation was, you said it's a very sensible topic, you know, to open up, to trust someone, to trust a medical person. And that's where, on the other hand, the pandemic with being very chaotic at times, and maybe people don't even have the time. How did that impact your work as organization, and how did the pandemic impact this group of people specifically?
I think the pandemic was not a good thing by any means. It was a very difficult and challenging time, but I do personally appreciate it because it exposed a lot of thoughts and feelings within my community that we'd kind of pushed under the rug. So specifically in this working with young women, the pandemic kind of removed working, or at least working in the wider world, working from home and stuff like that were introduced. So I think one thing that we talk about frequently in our sessions, and we have them every Saturday, and we just, vent and, just talk. One thing that we frequently mention is within minority communities, and it's another learned behavior, we dismiss healthcare as I don't have the time to make a GP appointment, or I don't have the time to go and access or go to A&E. That kind of removed that element, and it exposed that it wasn't time necessarily, it was a lack of inclination to, and it was a learned behavior because of their past experiences with medical professionals. And then another thing that we acknowledged was, with the pandemic removing work, a lot of young women, minority young women, have learnt from their parents to use work as a trauma response. So using it to distract themselves, overworking themselves, which leads to mental health issues, and the pandemic kind of stripped that away entirely. And a lot of us, me included, felt like we were drowning, but it made me aware as a worker, okay, this is a big problem, and it allows me to address it. So that was one of the most prominent challenges faced within the pandemic period, is this mental health aspect, and a lot of women's main coping mechanism being stripped away.
Thank you very much for highlighting some of these aspects and really showing us how your work has been shaped and impacted during the pandemic. Again, this is just a setting the scene panel, so we are really just offering a few perspectives on different issues. We will have more time and workshops and discussions that will dive deeper into, for instance, some of the aspects you just highlighted. Thank you again for sharing. So Amanda, you work as a consultant with WHO in Venice in Italy, and in your work you focus on, for instance, mental health, social inclusion, but also, of course, young people, and especially you work in the field of well-being economies, very interesting. Can you tell us how your work connects to the perspectives Aisha and Daniel have just shared with us, and maybe also relating to some of the findings on health inequities we find on youth in the region? The microphone. Perfect.
Okay, is it on? All right. Absolutely. Thank you so much, Claire, and thanks to the panelists for sharing their views, because I think if there's one thing that's really hit home to me in the work with young people is that that we have to hear from them and from them directly, because the intricacies of these experiences are very important for us to understand. So really, I'm in listening mode, like my other colleagues here, like Rob had said, and so I just have a few reflections of things I've learned in working on these issues around young people and mental health and social inclusion, and how they help us to really, I think critically about how we can build better economies and societies going forward to help address some of these issues and the role that the health sector can play in that. So as this conference has already brought forward, we know that this simply cannot be done without young people. And this is not just tokenistic, it's also not a political platitude. I am very convinced that this is a technical reality. So we know that there's a big gap sometimes between how adults and experts and policymakers frame issues to do with young people and their health. And this often doesn't resonate with young people themselves. And this is what research and practitioners are finding, that the way we understand these issues just isn't enough. And it's not connected enough to the lived experience of people, that are sometimes suffering and that need better health services and their health issues to be addressed. And so we've got to have these engagements a lot more, and I'm excited to hear more from young people this week about their experiences so that we can incorporate that into our work, because it's incredibly important. And the second thing I've reflected on in this work is that I think before COVID, we heard a lot about transformative change and the kind of 2030 agenda for sustainable development, and we wanted to achieve these goals. And we know that during COVID, there's been some backsliding on those, and also backsliding in terms of inequities. We know that people who were most vulnerable, often before the pandemic, were made more vulnerable during it and suffered some of the most severe consequences. So we have a lot more work to do. But I think also if we want to be serious about transformative change, we have to listen more to young people and the many transitions that they're going through in their everyday lives. There's so many changes in that demographic. You're shifting from being a child to being an adult, from being in a classroom to becoming a teacher, to all of a sudden parenting, to having new functions in society. You might be becoming an activist or a writer or an actor or a practitioner in the medical profession or a lawyer or a doctor, etc. So there's all these new roles the young people are transitioning in and out of every day, and they're managing that in an incredible way. But we also know that all of those transitions in and out of homes or in and out of jobs also affect our health. And we have a huge evidence base around that. And over time, it also affects your health over the life course. So I think we really need to understand those experiences better, to understand the health consequences of them, and work with young people to figure out how we make those things safer, better experiences that help people not just survive, but really thrive moving forward in their lives. And I think the last thing I've learned really that I want to touch on is that recovery for all of us in these transitions are simply not a linear process. They're messy and they're complicated and they're difficult, and it takes a lot of resilience and a lot of support to get through them. So I think we find that in peer networks, in community and social support networks. I think we also find that intergenerationally. We have to learn from people who've been there before that can help us find the way. And sometimes that's parents, sometimes that's mentors, sometimes that's teachers, sometimes it's doctors. There's a lot of different kind of people that do that for us. And I've seen that when young people feel safe and secure and have the tools available to them, they're able to innovate, create, and make new solutions for the challenges that we uniquely face and that generation will face going forward. So I'm just really looking forward to this conversation this week, and these are just a few early reflections on, I think, how we're coming through this transition and trying to do that together in a way that builds more trust, I think. Thanks.
Thank you, Amanda, for your reflection. And talking about health inequities, the LGBTQI+ community is one of the most highly affected groups in terms of that. And AKT is an organization that addresses these issues in particular. They connect these issues also to homelessness, queer people. So that's a very specific and very interesting perspective on the issues. And Link, you're a member of AKT. And I would like to know from you how, first of all, you got to know about the organization, and also maybe you can tell us a little bit more about the work they are doing.
First got in touch with AKT through, I believe it was a poster that I saw. It was advertising help for LGBT youths, and gone through a transition in terms of housing at the time. And they helped me massively finding a new place with other family members that were far more supportive of lifestyle and stuff like that. And during the pandemic, like it was discussed in the video earlier, the voices online really helped people figure themselves out a lot more, having time with themselves, with their friends, being able to communicate and transfer information that they needed. So a lot of people did go through massive transitions through the pandemic and at home through the whole process. And yeah, a lot of families didn't take too kindly. So there's often a negative reaction to someone being a member of the LGBT community, and kind of a stigma around it being a negative thing. That's why like coming out is sadly still a thing. And yeah, through the pandemic, I got back in touch with AKT to help with my mental health, because I couldn't access healthcare myself because of the change of residency was still in effect. So I couldn't access a general practitioner or a doctor unless it was life-threatening, which massively impacted me. But AKT were there to help me come up with coping mechanisms and new ways that I could figure out how to exercise or learn new skills and keep my mind occupied and communicate effectively with family members throughout that whole period.
Mm-hmm. Can you maybe tell us more about the working methods of AKT? And also you highlighted a very relevant issue in the health system, which is just immediate healthcare in terms of people already being on the edge of health issues, but maybe there's a lack of consultancy support throughout. So what would you wish from governments and policymakers to put in place in terms of support mechanisms?
Definitely more funding into mental health research and opening up more information, because a lot of general practitioners with young trans people actually gatekeep the information that they might need to properly transition healthily, or get the right mental health help that they might need throughout the transition, because it is a very stressful process. And gatekeeping that information can cause a lot of harm mentally, physically, and emotionally to the individuals. Mm-hmm. So definitely more funding, because a lot of the, like AKT, a lot of the healthcare system is based upon charities for various groups. And without those groups, a lot of people would suffer massively, like the people I'm representing at AKT.
Thank you very much for highlighting also issues from a queer perspective in the field. And again, this is just to set the scene. I look forward to more workshops that will dive deeper into these specific issues. To conclude the panel, I wanted to ask you one final question, but because of time, I will skip that, but will still raise the question to maybe also encourage you to talk about these issues during the break, which we will have in a second. I think we all have very personal stories connected to the pandemic and our experiences. So maybe also let's use this opportunity to exchange about mechanisms that help us to cope with the pandemic and things that encourage us to be more aware of our mental health and well-being. And maybe we can take these insights to also learn from each other and exchange from our personal perspectives. Thank you very much to the four of you for sharing your perspectives with us. And you will be at the forum during the time, so I'm sure people can approach you more to dive deeper into your perspectives. That was a brief dive into some of the health topics which we will discuss about. And as Mr. Butler already introduced during the panel, we have the first two parallel sessions taking place at 11:15 after this opening session. And the first session is called Let's Talk Mental Health, Designing Better Support for Young People. And that is taking place in the Metropole room. If you can't find your way around, then there are a lot of people that can support you in finding the right places, so just reach out to them. And the second session is taking place in this room, and it is called The House of Cards of Public Health Policy Making. So I think for now we deserve a break, and I wish you much fun discovering the next two topics at 11:15. See you after the break.